So the key takeaway from our article is that patients with primary sclerosing cholangitis, or PSC, who develop intrahepatic cholangiocarcinoma appear to have a distinct risk profile, including higher rates of inflammatory bowel disease, including both Crohn's disease, ulcerative colitis, and then portal hypertension, and hyperlipidemia. My name is Uday Grewal. I am a senior medical oncology fellow at the University of Iowa Hospitals and Clinics here in Iowa City, Iowa. Our article, titled Risk Factors and Outcomes of Patients with Cholangiocarcinoma and Primary Sclerosing Cholangitis, will appear in the Mayo Clinic Proceedings. In early stage disease, we noted that patients with PSC undergoing liver transplantation had worse outcomes compared to those without a diagnosis of PSC. However, transplantation may offer better survival than hepatic resection with adjuvant therapy with capecitabine, which is the standard of care. No survival differences were observed in advanced disease based on PSC status. Our findings suggest a need for individualized treatment strategies, exploring the role of metabolic risk factors in this disease, and warrant prospective evaluation of liver transplantation in PSC-related intrahepatic cholangiocarcinoma. Using a large multi-institutional real-world data set, we identified key clinical risk factors associated with the development of intrahepatic cholangiocarcinoma in patients with primary sclerosing cholangitis, or PSC. We found that comorbid conditions like ulcerative colitis, Crohn's disease, essential hypertension, and hyperlipidemia were more common in patients with primary sclerosing cholangitis who developed intrahepatic cholangiocarcinoma. Among those with early stage disease, liver transplantation offered survival benefit compared to surgical resection with adjuvant capecitabine therapy, which is the standard of care. However, patients with PSC undergoing transplantation still had higher mortality than patients with intrahepatic cholangiocarcinoma without a diagnosis of PSC, suggesting a need for tailored therapies. These findings highlight the importance of screening for metabolic and inflammatory comorbidities in patients with primary sclerosing cholangitis and may guide risk stratification for intrahepatic cholangiocarcinoma surveillance. Additionally, they also suggest that transplant consideration should be prioritized for select early-stage PSC-related intrahepatic cholangiocarcinoma patients, particularly because resection may offer inferior outcomes in these patients. For patients with primary sclerosing cholangitis, this study emphasizes the importance of regular monitoring for cholangiocarcinoma, especially in those with coexisting IBD or metabolic conditions such as essential hypertension and hyperlipidemia. It also highlights that liver transplantation may be the preferred treatment in early stage cases, potentially improving survival outcomes when compared to standard surgical resection followed by adjuvant therapy with capecitabine. The next step is to conduct prospective studies that integrate clinical features and molecular profiling to better understand the biology of PSC-related intrahepatic cholangiocarcinoma. We also need to better understand the role that metabolic conditions play in driving intrahepatic cholangiocarcinoma in patients with primary sclerosing cholangitis. This will allow us to refine treatment pathways, help with screening endeavors, and help curate personalized treatment strategies for these patients. I invite you all to read our exciting paper that is due to be published in the Mayo Clinic Proceedings.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.